What do you see as some of the solutions that, could be helped with, federal government involvement? I mean, what are some bills that you see are just quick fixes?
Well, I think the prior authorization, I think anything that would help with prior authorization.
Okay.
I think those are big. You want to, you always hear, when it comes to, this is always my favorite topic when we get into it like this, because you always hear about politicians talking about fixing healthcare. And then you poll how many of those politicians making the decision are actually physicians. And it's staggering. It's sort of, and in fairness, sometimes I wish as a physician then I can then decide how law is practiced, because that would be only fair. But that being said, it's that the best way, in my opinion, is for people to help, or at least at the federal level to help with healthcare, is to understand what kind of problems physicians are having. Talk to the physicians taking care of the patients. So prior authorization, and that's a big one. Trying to understand when you cut Medicare, then you're cutting care that physicians either rely on to take care of the older population, 65 or older. It's now actually become somewhat of a marketing tool for physicians to say, we take care of Medicare patients, which is crazy. And so I think the best way the federal government can help is to try to understand what kind of problems physicians are having in the setting itself, and not have that input, I think, is a big problem.
What do you think about things like HSAs as part of the solution?
So health savings accounts, I think, are great, because then that gives the patient the chance to make the decision. The patient now is in charge of their health care, right? I don't understand why this is, I never understood why this is a problem. Someone can come in and they can have a one-to-one relationship with their physician. They can have that conversation. It's now time to dip into your health savings account for whatever it is that you need to have done, and then you move on. It lowers bureaucracy. It's very direct. It's very straightforward. We just got to make it better, because I just think the problem is, and makes a whole lot of sense, is people that are probably against health savings accounts are large insurance corporations, and I think that they must be lobbying against them.
We talk a lot about the patient relationship with the physician, the ability of a patient to be able to make choices that are personable to their needs. Their needs, their priorities, their budgets. Do you think that the approach with the one size fits all, the Affordable Care Act, has that helped increase quality or decrease cost or increase access? Do you feel like it's done any of those things?
So when it comes to medicine, there's no way that can be effective. And because if that was the case, then every single patient that we take care of, we would treat them exactly the same way. It just doesn't work that way. It is really hard to plan a one-size-fits-all type healthcare plan for patients when it's the algorithm of how you would treat someone, like which direction you would go, is endless. And that is really the art and the true practice of medicine as a physician, when they've expanded their knowledge to be able to know which direction to go. So if you have a one-size-fits-all type healthcare system, you're going to cram all of that in, and you're basically just going to create robotic doctors. And that's not good, because it only matters when you're that patient and you need that physician that knows what to do and how to handle it to fix it. How many times have we seen that? As I went to this particular specialist, and he had seen this before, and he was able to do this, and it saved my life, my family, someone's life. But what I always find interesting is you never hear on the other side of that, well, how'd they pay for it? Did they pay for it in a one-size-fits-all type? No, of course not. So just a one-size-fits-all type insurance plan is not something that ultimately is going to last.